Let's take a look at some trunk exercises. And I always like to start thinking about stabilization first. And one of the things we can do on the Bowflex in this seated position, you remember the pushing type exercise, the press from in here in the sagittal plane with the cable underneath medial to the arm. We also call it a punch, a resisted punch type thing. This is actually a great exercise for stabilizing with the trunk, because as I push forward, I'm having to use my anterior trunk muscles, which of course is the rectus and the obliques, to keep from bending backwards. So I don't want to be slouching here, but I want to maintain my erect posture. But a pushing exercise can really make it challenging by doing it on both sides. Now that's really tougher for my trunk. I could of course do it one arm at a time, not trying to rotate, but trying to maintain the static erect position. So again, working in stability. If I wanted to add a rotational component, I could of course, as mentioned earlier, and you could call this an upper extremity exercise, you can call it a trunk rotation exercise. It doesn't really matter, they're both being worked equally. Again, correct alignment is the key. Now, one of the most popular exercises is the trunk curl, spinal flexion, often known as the crunch, whichever one of those names you're used to. Let me show you something. On the Bowflex, if we lock this into the inclined position, the 45-degree position where we did so many other exercises such as triceps and chest, we have some options here. What I'm going to take a look at is using the resistance against the crunch. But there's a limitation you're going to recognize here real fast, and that is that as I'm laying here, I have my neutral curve in my spine. As it starts to go away due to natural spinal flexion, I really do a lot of flexion before the resistance ever gets moving. And so I don't have much motion left. I mean, I'm through flexing, and I hardly get to move the resistance at all. For that reason, here's a couple of options. We have created a multi-layered pad, so someone could alter the thickness, the amount they put behind their lordosis based upon their ability level. And I can also adjust the shape of the curve by moving pieces of it more towards the top or the bottom. My point here is that I support the lordosis, not because it needs to be supported like it would be in a seated position or in a car or for any of those reasons. Remember, the whole purpose of a crunch is to leave the lordotic position behind. That's the definition of flexion, is decreasing lordosis. But by having it back there, I have, in essence, a new fulcrum, a point around which the resistance is going to be applied. And look at the motion I get now in my flexion. So if I apply the resistance, and let me give you a couple tips on that. There's a couple ways. I can hold the resistance here on each side. All right? This gets kind of uncomfortable if you have a considerable resistance. For some people, this is not a problem at all. Now, one option that you can try is bringing this around underneath and holding it just for a second on each side. And I could do this on the other side too. And then reach across on each side. Now that's a little bit easier for some people. Your elbow's not pulled into flexion as much, and it doesn't feel like it's pulling it apart. And it's more relaxed, just arm crossed across the chest type position. A lot of people like that. I'll show you one that I've had considerable success with just in terms of comfort for people, is really spreading this handle apart from the strap and having them put their whole arm through it so it rests up here on the anterior shoulder. And then again, they can just cross their arms like they normally would. But this is really easy to do. Again, it just depends on whether it's comfortable for you or not. You may try different arm positions just so that it doesn't pinch. It may feel better for you. But there are some great options for a crunch. But the key to the crunch, filling up this gap underneath, this lordosis. Now, you don't have to go buy something or go to a manufacturer and have something made. You could get a considerable thickness of towels or cloth. And notice it's not wrapped or into a tight circle, but it's kind of in an oval, which will conform better. And you may even progress over time something small to something bigger as you progress to different starting positions of extension. So again, even with this little rolled up towel, beach towel type thing, I still have improved motion and improved resistance for the crunch. This is very, very similar to what a stability ball, Swiss ball, or gymnastic ball offers in terms of starting position. Take a look at this. Now, if you've ever seen the resistable or the stability ball used before, Of course, you see people typically doing crunches in this position. And the thing that this ball offers in terms of abdominal work is not only the necessity of stabilizing side to side, but also this improved starting range and the support underneath here that allows greater resisted motion for the trunk flexors. Now, one of the problems with the ball, you may have an awful lot of people who just find increased fatigue in the cervical region when using this, and they may get to where they can do an awful lot of repetitions. One of the ways that we can incorporate this with the Bowflex, I would push it back here and use the ball more in a normal seated position with the ball behind me. You could even put your bottom on the ground maybe, or have it up a little bit, it's up to you. But the point is, I'm still using the ball for support back there and as a fulcrum against the motion. But by being in more of a trunk vertical position, the resistance is now pulling posteriorly on me. And right there, I get a nice application of resistance from the Bowflex. And because my head is more balanced over my trunk, there's not as much cervical fatigue. Nice combination. Now, a lot of people like to do very specific oblique exercises. And of course, we know that there's no such thing as an isolative trunk exercise. You know, the rectus is always working in these flexion-oriented movements, even if they're at a diagonal. And even when I'm doing pure flexion, the obliques are always working. That's why we shouldn't think of them as the abdominals or the obliques. They are all abdominals. Now, for those people who like the diagonal type of motion, you notice I've got the support under my low back right here because I'm sitting here talking to you, but as I go back into the full extension, I'm starting in a greater degree of lordosis. I can hold the handle again in my hand and come across at a diagonal, or I could use the method with it on the shoulder and go straight across the body. So it's not a flexion and then a rotation. It's not a rotation and flexion. The concept is a pure diagonal motion, just like this. Now, another thing to think about on the regular crunch or on this motion, the concept is not just to sit up. It's not just to raise the whole body up, but it's to bring this attachment of the musculature closer to this attachment of the musculature. In this case, it's this attachment closer to this attachment. So I'm concentrating specifically, concentrating hard on trying to bring this area towards this area, not just pulling on the resistance. Very important cue for you there. Now, for the erectors, and really all the stabilizing musculature of the posterior side of the spine, we need resistance pulling from the front to direct our effort towards the back part. And in this seated position, you can mimic the way most commercial machines work. Most of those have an axis that allows hip motion, and the goal is to stabilize the spine. So we can see that right here. Notice I've got the resistance up here on my forearm, so I'm not trying to hold it. And I'm trying to maintain my spinal alignment as I go into hip extension. So there's one way of addressing the posterior spinal musculature. Another way is of course, to hold the hip still and allow eccentrically to be pulled into flexion, concentrically taking it into neutral, and even beyond as it's comfortable for you. Not everybody can go into the same degrees of flexion and extension, but if you're doing it slow and controlled, letting comfort be your guide, use the full range that's available to you. So there's an option also. Now, as a professional, you'll need to prescribe the specific exercise based on when you got someone with a disc problem, some other form of sciatica-related issue, SI problems, muscle spasms, or all kinds of spinal issues, and you will choose the stabilizing one or the motion-related one based upon the individual differences. Now, we can also address these in more of a standing position. So I can stabilize my body here and still do the hip extension. I'm trying to keep my knee basically bent. I can straighten my knee a little more and straighten my knee as I stand up also. So there's an option. If you actually go into the spinal flexion here, it's going to get really, really complicated. It's hard to do that with much control. So I would probably stay away from that and think about more isometric, just like a normal lifting type of motor sequence, where it's hip and knee with spinal stability. Now, there's a lot of different controversy and conflict out there regarding the use of rotation. We've already discussed it some here. There are three key factors in training for rotation. First and foremost, the spine must be in an erect posture, in neutral. We introduce one position into the spine, all other motions and positions become limited. So we want to stay away from doing it in a crummy, flexed position. Proper alignment, and then also we need to watch the range of motion. In this example where I am seated, I am eliminating the option of any other joint motion through which I can disperse forces or create greater range. This is very different from a functional rotation associated with a pitch or a bat swing or even a golf swing. This is very isolative, and because of that, the range of motion must be limited. There are only 30 to 40 degrees of thoracolumbar rotation to either side when it's limited like this, anchored at the seat, anchored up here at the upper extremity. So, limit the motion, keep the proper spinal alignment, control the range, control the speed. If you're going too fast into the eccentric, that's where you're going to get into trouble because the forces will increase dramatically on that disc. Remember, the lumbar facets are not built for rotation, so control it. Now here's a great crunch exercise you can do with the squat attachment if you have a lumbar pad that you can put underneath here. And again, it's not for lumbar support as much as it is to create a fulcrum under the neutral lordosis. You can even go, I've got a larger pad here, half moon type pad, to add even greater position of starting extension from which I'm going to create flexion against resistance. This is great. Of course, the pads on the squat bar work well to make it comfortable. Another great option for crunches. Now we can perform what is basically a version of a squat with a bar in a different place, a deadlift. It's not a traditional deadlift because we're not using the free weight, so we actually have a varying resistance because of the power rods on the Bowflex. So I have less resistance where I'm down here and weaker. I have more resistance at the top where I stand up. And you only have a couple options for performance here. A more traditional deadlift, people will typically do like a squat where the knee moves forward quite a bit and they try to stay more erect in the spine. But you may want to do more hip motion, which of course is tougher to stabilize in the spine, but it may be more useful for you, depending upon the goal, depending upon the individual. So here's one application and another application. And again, without the inertia, someone can be explosive if they need to. For the lower extremity, I really want to look at leg presses first because we're addressing hip extension, which includes the glutes, the hamstrings. We're addressing knee extension for the quads, the vast majority of the lower extremity musculature. So for a beginner, this is often just the place to start by itself. Now, we can look at all the isolated things later, but there are a couple tips to setting this up. For example, putting the feet through the frame here to get close enough to make the hook latch. Makes it so much easier. Don't try to do it without putting the feet in here. Next, don't have this belt up like it's a weight belt on your lumbar spine. It needs to be down across your pelvis and across your sacrum on that bony foundation. And then as you push back, you can step out of it 1 foot at a time. Now, you have some choices to make at this point. I would suggest starting out with most people putting the arch of the foot on the upper frame. Give that a try. And now as you go through the motion, of course, we want to make sure we have alignment of the lower extremity, aligning the femur with the foot angle. With the upper frame, especially with the chest bar on it, I have a little wider option. It's kind of nice. So as you go wider than the hips, make sure that the feet and the femur are lined up perfectly, slightly pointed outward. If you go closer to hip width, they can both be pointed perfectly straight up. But again, I would not suggest necessarily pushing through the ball of the foot for leg presses. We may do that later for calves, but for leg presses, stick near the arch of the foot, or actually maybe where the ankle comes into the foot. Now you can also move back to this position. You're going to have a considerable difference in load because the rods are flexing more. You'll also notice there's a different relationship between the knee, the hip, and the foot. This encourages much more knee motion than hip motion. At the same time, anytime that occurs, you've got more forces on the knees. So different people are going to require different things. If someone has any kind of knee problem whatsoever, you may want to keep them on the high position. So there's an improved relationship between the forces and the knee. It's going to feel really nice for most people. Some people may be able to improve the effort from the quad, more benefit to the quad. But remember, more work from the quad means more forces on the knee. This may still work for a lot of people. Just make your choices accordingly. It's not automatically plugging one exercise in or the other. It's making your choices based upon individual need. All right, we're going to take a look at some isolating exercises. Isolating not meaning working single muscles. We know that's not possible. Isolating in terms of joint motion. Now, I'm showing you these because so many of you as professionals understand the concept of working on deficits, trying to bring someone's imbalances up to par, even their asymmetries. And for that reason, especially chiropractors and therapists trying to work on pelvic imbalances, it's real important to understand the concept of isolating hip motions, specific ankle motions, that kind of thing. Now, we as an industry, of course, have to get away from the concept of spot reduction. And when a female you're working with wants to do hip extension exercise after hip extension exercise, she's obviously not thinking, gosh, I need hypertrophy and strengthen my glutes. Somehow in the back of her mind, hip extension still is equated to spot reduction. Hopefully we're all going to help dispel that myth, right? Talking about hip extension, I can spread the handle here. I'm going to go ahead and put this all the way up across my shoe. And I'm going to do kind of a straight leg hip extension. Can you see that? Now obviously in this position, starting out in neutral here, I've only got 10 or 20 degrees behind my body. You need to watch that range because the tendency is to go into a bunch of spinal extension if you're not careful. If I scoot back a little bit, notice I'm using the power rods here for some balance. Now I can go into some flexion as a starting position and get more range to my extension. So that is an option for you. One nice thing about this is you are loading through the other extremity, the supportive extremity, and that is nice for the hip muscles on that side, especially the gluteus medius that's helping to maintain pelvic balance and stabilization. So there's an option. I could also alter my hip position again. Now I'm starting about 90 degrees of hip flexion and coming through. So there are variations you can make based upon the length-tension relationship in the hamstring that you'd like to use, or based upon the hip range or portions of the range that you'd like to resist. Just some concepts for you. Of course, I could do it without hanging on at all. If you have, maybe up to 40 pounds on this, the machine will not move. If it's on the carpet, it'll stay stable. So I could do it just standing here, which is great, again, for the side I'm standing on. Very, very important. Okay, something else I could use this for in terms of hip extension, separate this thing and bring it down under the arch of my foot and then kind of close it back up. Now I can use it for more of a knee and hip extension at the same time. That has a different incorporation of the hip musculature because the hamstrings are basically not changing length very much, and it's going to be a little bit more glute. And as your hip gets straighter, your hamstrings lose their mechanical ability, even though they're becoming straighter at the knees. So just some things to think about there. There's another option. Of course, for every one of these, you could have done the abduction and standing. Again, I don't think about this abduction and standing so much for the hip that's moving, much more as an exercise for the hip we're standing on. Because when I'm pushing out, it's trying to throw me off balance over here. So that's a really nice resistance application. Not so bad for this one. That's fine to work through a range of motion over here. But the one you're standing on, that's getting some great benefit. And of course, I could take this off and do an adduction type application in the same manner. Now the supportive leg is over on this side, and that's what's doing most of the work. This is simply throwing me off balance. Now, believe it or not, a lot of people do need to work their hip flexors. I know a lot of people avoid it because they say, well, the hip flexors are tight, we need to stretch them. Yes, but one of the important things about stretching a muscle is stretching a muscle that already has some integrity and some health in it. And a muscle that's never really had resistance applied to it and doesn't get to work through its full range doesn't have the same integrity as a muscle that sits around in an adaptively shortened position. So addressing the hip flexors is important. It doesn't make them tighter any more than working anything else makes you quote-unquote muscle bound. We know that was all a myth. But here's one way of addressing flexion. I'm just standing on my left leg, doing a straight leg, hip flexion on this side. It's not too bad. It's a little bit tough to balance, but that may be part of the issue with it. Let me show you another exercise that you might prefer. I'm going to change sides. I'm going to try it in a supine position. So if you want to come down here and take a look at me, I'm just going to hook this over my foot here and put my other foot against the foot plate. Now I want you to watch. I'm going to do this with my knee flexing. And this is really consistent with how an athlete would very many times have to use their hip flexor. They might come up like this and then straighten out. That's something else I could do. Now there's some nice hip flexor work that for very many people could be extremely useful. It's actually easier in terms of stabilization, but in many ways it gets more advanced in terms of motor pattern. Just try it. You might have some people that it works well with. Now in a seated position, I could use this for my abduction. Realize in the seated position, when your hip is flexed, you're not working your gluteus medius, you're using other muscles as abductors, such as the piriformis and maybe even the gluteus maximus. It's not a very functional exercise. You really don't see a point in it at all. You could do your adduction, and a lot of folks want some hypertrophy in this muscle if they're a bodybuilder or something like that. This is not a spot reducing exercise, just as this one was not an outer thigh reducing exercise. Please, please help us get rid of that myth in this industry. Neither one of those is extremely functional. You really have to find a specific goal where they'd even be useful at all. Here's something that may be useful for those people who are working on pelvic imbalances, SI stabilization, and rehab situations, is hip rotation. Now, in a seated position, I have an inversion of action. It's not the same hip rotators as it would necessarily be in standing, but I am currently doing internal rotation. Now, I'm having to hold my leg up a little bit so my foot doesn't hit the floor, so there's a little extra stabilization effort from some flexors. But in this position, my internal rotators are different than when my hip is in neutral. We'll take a look at that in a minute. But right now you can tell, even though my foot's going outward, watch my thigh internally rotating. So gluteus medius, yes, there's going to be some of that, but also your tensor becomes an internal rotator here as well. Very interesting inversion of action. I could do the external rotation from a similar position. Now in a seated or hip flex position, you have a greater range, number of degrees of internal and external rotation available. You can also see something you might not like about that exercise was the fact that it put load across the knee. So if someone has a medial collateral problem, this might not be ideal for them. You've got to look at everybody's individual problems. Now I'm going to raise up out of the frame now, but I want you to see an interesting hip rotation exercise, if I can keep from screwing up my microphone, in the standing position, because now I can create it in a hip neutral. And of course, if you're working with a patient, it's a lot easier to get into, but watch this. My hip is in neutral. I'm performing internal rotation. So for those people who are not necessarily addressing the musculature or the motor pattern in a seated position of hip flexion that you want them to, you can still do it in a hip neutral position, just like that. Now at the knee joint, obviously leg extensions are something we can do for isolated quad work. And one of the ways of doing that on the Bowflex is kind of unique, but I'd like for you to try it and see how you like it. Now I've got the narrow pulley position, but I still have to point my leg towards that pulley because it may be wider than your hips. We don't want the resistance pulling outward on your knee. Very important. So I angle it towards the pulley. If you can see that little change I made right there from straight in line with my hip towards the pulley. And notice I've got the strap. Take a look at this. See how it's separated? And I'm going to leave it like that and put the strap over the top of my foot. The handle will then fall into the arch of my foot. I really like that little leverage type situation created right there. But I can also hold and help stabilize, or I could stabilize actively and perform my leg extension. All right? That's a nice way to do it without any forces coming in the back of the leg via some stabilizing pad. Now here's a little resisted movement I really want you to take a close look at because it's awesome for providing resistance against a little more functional application of force through the leg. Very interesting here. Take a look. I've spread apart the handle and put the strap around the back of my knee. Now I'm going to put weight on my leg and I'm going to go into a closed chain extension of my knee, a terminal extension. And the important thing here is the controlled use of the quad, especially the VMO, vastus medialis, oblique, in creating the extension. A lot of people will think that the goal is just to move the pulley, so they'll just do stuff like this. That is not the goal, just to move the machine. The goal, and the goal is not necessarily to use the hip extensors. In any closed chain, This can do a lot of work to create knee extension as well. That's basically the definition of a closed chain. What we're looking for is using these muscles to specifically control the end of extension. The Mayo Clinic did some research a few years back and showed that one of the reasons we pop back into hyperextension is not because the hamstrings are weak, like so many people have thought. If you look at the mechanics of the hamstring, they're terrible at controlling the last few degrees of extension. The key is the amount of control that the quad has as it goes into extension. So consciously working on this, especially like I said, maybe even if you use touch to help cue the VMO in this position, this is a wonderful little exercise. But you must take great care that it's performed correctly. Someone just standing here doing this will get nothing out of it. Now I want to talk about the leg extension attachment, and there are a few issues to take a look at. Number one, the pivot point. It is virtually impossible to use one single pivot point placement and have it work well for everybody, because everybody has a different thickness of muscle and tissue on the back of their leg, fat, everything else. But you can see here that this pad is a little bit spongy. This placement is a little bit anterior and a little bit superior to this pad. Well, that's actually kind of nice. It ends up being 1.5 to 2 inches, depending upon the pressure put on this, away from the back of your leg. Now, the pivot point of the knee is near the back of the knee. So that's not a bad axis placement. The way you can tell, take a look. As I perform this motion with my knee against this pad all the way, not held forward like that, but against it, you'll notice that the ankle pad does not roll up and down my tibia. If it did, if it rolls down or it rolls up, that's indicative of the fact that my axis is not aligned with my knee. So you can tell, if you're sitting and looking at this, you may go, oh, I don't see how that can line up. And it might not be perfect for everybody, but I promise you, if you sit on this thing and it's not rolling up and down your tibia, then it is aligned perfectly. All right? The other thing to take a look at from this point of view is the fact that the angle of application of the cable is changing. You'll notice that right here, it's less than 90 degrees. There you go. Actually, I guess you could say it's greater than 90 degrees, 90 degrees being optimal. About right here is we get the optimal application of resistance, which is just about near where my knee is 60 degrees from full extension. You want to go up just a little bit so we can see that. There we go. That is exactly where we want most of the application of force in this single joint movement. And then again, you'll notice the force angle getting smaller as we get out here, because this gets to be a little weaker position. So maximum strength was in here, weaker all the way out. Let's take a look at this from another direction. All right, take a look at the leg extension from this point of view. You don't need to see me, you just need to see my knees. Now, watch this. Very, very typical for people to sit on a leg extension with their hips in external rotation. That creates an axis alignment of my knee that's something like this on this side and this on this side. With each axis aligned like this, there's no way it can work well with a machine axis that's parallel to the ground. So it's very, very, very important that we turn. Now if someone's already sitting on the machine and it looks like their patella is right on top and the axis is straight through, that's great. You don't need to turn anything. But given the fact that most people sit here like this, it's very important that we encourage them to maintain the patella on top, which is just a rough estimate of the axis being straight and parallel or lined up on each side, as well as with the machine. Now, for those health professionals out there that have spent the past few years doing the same mistake that a lot of doctors and therapists prescribe, which is turning the legs this way in order to address the vastus medialis harder, you're making a huge mistake. This is a hinge joint. Hinge joints are single plane movements, right? Any hinge, just like the door of an old Camaro, over time the weight pulling across the hinge screws up the door. And you have to lift up on the door to close it. We do not want our knees to act like old Camaro door hinges. In other words, there's only one direction of force that's appropriate for this knee, and that is through the center of the knee. The only way you could get an appropriate application of force in this position is if your knee was like a ball and socket joint and could move in this plane even though it was turned outward. That doesn't happen. By being turned like this, it wants to move in this plane. Totally inappropriate. I hope you can see that. So here's our only alignment option on this exercise. Now, if you have those people with considerable lateral tracking problems due to a large Q angle or some other tight retinaculum, something like that, here's something you might try. It's not magic. But when we made this first alignment change right here, we were looking solely at the hinge. This hinge alignment cannot be made based upon where the foot is pointed. Some people say point your toes in, point your toes out. That's an old bodybuilding thing to work one part more than another. Forget that. It's pure myth. Forget the feet. Align the knees. There's something you can do with the feet. If someone has a large lateral tracking problem associated with a large Q angle, a lot of chondromalacia, a lot of pain with loaded leg extension work, you might try having them do internal tibial torsion. Now, since you can't just sit here and say turn your tibia and have them actively know what you're talking about, you might have them point their toes towards the center, which will encourage the tibia to follow. But if they point their toes towards the center and then they internally rotate more here, they've blown this. Once this hip/knee alignment is set, this must not change. And any attempt at turning the tibia inward must not alter this position. Now, this is not magic. If this bothers somebody, don't do it. Although after 1,000 patients, I have yet to see it bother anybody. In fact, most people, even the average people out there with even slight chondromalacia, feel decrease in popping, decrease in noise, decrease in discomfort when performing a leg extension in this position. If they don't worry about it. Just an option and a variation for you. Now for the prone leg curl to address the hamstrings, again, this axis needs to be aligned with the knee. If you lay on this machine so that the superior aspect of your patella is just barely touching that pad, it works out about right. And a great check for that, little test, notice as I curl, that pad stays roughly the same place on my tibia, not moving relative to the edge of my sock you can see there. If I was out too far, watch this. See that pad roll up and down my tibia? That's an indication of improper axial alignment. So once you're aligned, there's going to be other alignment issues we're going to show you from another view before you would actually worry about doing the exercise, but we'll get to that in a second. I want you to think about two things. Number one, taking advantage of this bend in the machine so that you're not up like this. You're in a position of hip flexion. There's a reason that all machines are in hip flexion now, and it's very important. Take some of the passive stretch out of the hip flexors so that you maintain proper spinal alignment. Next, we're going to tighten the posterior muscles just a little bit, the hamstrings and the glutes, just enough to take a little pressure off. Now notice I'm not lifting my knees clear up off the pad. I'm just taking a little pressure off for stabilization purposes. Do you see that? It's ever so slight. And then I'm going to tighten my abs so that I don't go into this. If I lift my knees ever so slightly and tighten my abs, I will not have a tendency to do this kind of a cheating motion that decreases the actual concentric shortening and eccentric lengthening of the hamstrings. So here's the goal. Barely tighten, not lifting all the way up, just barely tightening to take some pressure off, tightening the abs, and watch as I go through the motion. Nothing changed in the hip, nothing changed in terms of knee height. That's what we want to look at. Now, watch for this other alignment issue I talked about a minute ago. Okay, I'm up on my elbows so I don't squish my microphone, but I want you to see that we have the same rotational alignment issues with the axis that we did in the leg extension. I not only have to worry about anterior and posterior, but I've also got to worry about turning. Well, you can see right now, if my leg maintained this position and did a leg curl, you see that plane of motion? That's not congruent with the way the leg curl is going to move. So if I'm laying here, I'm going to have to turn my femurs inward just to the point where the axis of each knee is aligned and basically the patella is pointed straight downward. And now, as I go through the motion, thinking about elevating the knee ever so slightly, not actually from the pad, but just taking the pressure off and tightening my abs, everything should be okay. Now, if as you're doing this, you notice your client start to turn one tibia outward, it's going to look like a foot's going outward. But it's not due to loss of rotation here in the hip. What it's due to is tibial torsion. You see the short head of your bicep is a pinnate muscle and oftentimes found to be stronger than the other parts of the hamstring. So you want to encourage them to tighten their adductors to help stabilize the knee and to try to not torque the tibia by keeping the feet relatively parallel. Now, if you don't have the leg extension leg curl attachment, there's still a leg curl exercise you can do, isolated knee exercise. And it's kind of similar to the fact that we had a leg extension exercise even without the attachment. This just takes a little bit to set up, but it ends up being a great exercise. Now pay close attention because the force application here is tricky, but works out well if you do it right. I'm going to spread this and put it on the respective leg. So the left pulley and the handles on the left leg, right on the right leg. You might tighten it up just a little bit so it stays close to the ankle. Now here's the tricky part. I'm going to take my feet and I'm going to cross them. Now I've got to watch my microphone wire that you won't have to worry about. And that's right, the cables are going to cross. So they are pulling towards the opposite side. But it's not a problem if you allow your feet and your knees to stay together, because there is a force vector created. Whoops, I kind of got that wrapped up right there. There we go. The force vector that's created is right through the center, assuming that you have the feet together. If you hold them apart, then you're going to have forces across the knee. Put them together, each leg takes up the respective medial forces being applied, and there you have a pretty decent leg curl. Again, I'm not allowing my butt to go up in the air. It's a little tougher on a flat bench to do that, but I'm just going to keep my posterior muscles tight and my abs tight, and there you see the motion. Now, while we're talking about these handles, you know, we've seen a lot of exercises where you try to put this whole thing over your shoe, over your whole foot. Here's a little tip or two. Take a look at this. A lot of times this thing will be attached and you're trying to put it on like this. The cable's pulling on the D-ring right there. There's two things. Number one, you can take it all the way off and put it on your foot first. And even if you leave it attached, here's the thing to do. Don't try to put it on to where the back strap goes underneath your foot and the handle, the hard handle's on top of your foot. It ends up being really tough to get over your heel. If you turn the thing sideways, it slips on very easily. It easily makes enough space to get over the heel, which is a thick part of a tennis shoe these days. So there's just a little assistance for you. Now here's a really unique hamstring exercise, and it's a compound joint movement. It's definitely going to emphasize the knee flexing portion of hamstring activity, and in many ways it's not the same contractile change, in other words, full concentric shortening and full eccentric lengthening, that other hamstring exercises are, but it is a unique motor pattern. You need to make sure the seat's rolling. Hook the belt on. Obviously I'm facing the opposite direction from a leg press, but I'm going to come out this direction and hook my heels over the leg, the part of the frame down there. Now watch. As I pull, I'm obviously using hamstrings, and don't worry about your gastrocs. Your gastrocs are knee flexors also. They're supposed to work when you do this. But there's a unique hamstring exercise, and if all the others are uncomfortable for you or don't work for your specific patient or client, this is another great option. Now here's a relatively advanced exercise that not everybody's going to be able to do. In fact, probably very few people, but it's something they can work towards. And it's the stiff-legged deadlift. And it's a fairly common exercise in tradition in terms of the old magazines and things we've seen. But it actually turns out to be a pretty neat thing on the Bowflex because of the resistance profile offered. You see, in this standing position, obviously the resistance is almost balanced through my joints. I'm pretty strong here. As I move forward like this, my strength decreases, but the resistance from the Bowflex also decreases as the rods straighten out a little bit more back behind me. So this is a neat little application for this specific exercise. And you want to be up near the front of the pulleys where the cable comes in. I don't want to be like this because it's going to have a tendency to pull me further forward and will stress my low back more. But if I'm like this, so that the resistance pulls straight down towards the middle of my foot and my hips go back, keeping my knee near a straight position. Notice as my hips go back, my knee must float back also a little bit. Not going any further into the range of motion than what I can control with my hamstrings. Never allowing spinal flexion to occur. Very, very important to keep everything tight and stabilized with all the abdominals and all the trunk muscles. For a calf exercise, posterior ankle muscles, we can put this in the leg press position where the seat is rolling. You've got the belt around the pelvis, not the lumbar spine. And then you put the ball of your foot, not your toes. This is very important. So many people just barely grip with their toes on this bar. It's really unsafe. I want you to put the whole ball of your foot right where your toes attach up on the main frame up here. And then you very simply do kind of a heel raise type of exercise where you're plantar flexing concentrically against resistance. Now, you're going to need to choose a knee position. I may hold mine in maybe 20 or 30 degrees of flexion right here and try my best to keep it there as I go through the motion. Going as far eccentrically as I can control, as far concentrically as I can control and squeeze. Now again, you're not going to have the inertia that you would with a weight stack, so it's going to be a lot safer both directions. A lot of people try to bend their knees in an attempt to get the gastroc out of it. If you're going to do that, it takes near a 90-degree of bend, much like most of your seated calf machines, in order to work primarily soleus by itself. Now, your soleus was working all the time. It was working in the other exercise too. It's just that this will have a tendency to let the soleus do a little more on its own as the gastroc nears that active insufficiency type of state due to the new length-tension relationship. Now, so much of your ankle musculature training you're going to want to do in a standing position, because that's where we get the proprioceptive and kinesthetic awareness that's really important, the stabilizing effects, really, really critical to do it in a gravity-based standing situation. But for a lot of rehab settings, for a lot of hypertrophy-oriented things, there's many, many reasons to do isolated ankle exercises, just like the calf exercise we just saw. But how many people have you seen that have really, really weak tibialis anterior muscles, weak dorsiflexors? So here's a way we can address that. If you'll take the handle and spread it apart. Now we're going to do something interesting with this. Pay close attention. I'm going to pull the hard part of the handle towards me and leave the strap towards the bottom of my foot, the plantar surface of my foot. And I'm going to put it clear down under this small part of the shoe at the arch so that it hooks around there. And then I'm going to let the handle rest against the top part. I'll pull it snug against, but the rest of the webbing goes underneath. Now you see I've created kind of a force couple thing there that really holds it securely on my foot. So as I go through the motion, it has no tendency to slip off whatsoever. It maintains a nice force angle of resistance. This is a great exercise. Now, one thing you can't tell very well from where you're viewing this is that I am angled. The actual bench is moving this direction. Straight in line with the machine is this direction. I have angled my right hip almost off the back part of the bench back here, and my foot is angled towards the pulley. So my leg is sitting crossways to the bench. And you can easily see that if you're looking from above. You know what I mean now by applying the resistance through the plane of motion. And if I was to apply it for my left one, I would angle more towards this other pulley over here. So you have to change your body position at that angle. And that's not a tough thing to do. This is the real tricky part right here. You might even zoom on that to take a closer look. And we'll see a little closer look what that's going to look like. And you've got the strap around here, handle, and then the webbing back over there attached. Okay. Now we'll take a look at the isolated motions of inversion and eversion. Again, we're going to spread this handle really wide. Now you could just put it over your foot like this and try to cinch it up. And you could do the inversion no problem. But a lot of people find that it wants to slide off after a couple reps. So we're going to try that trick again where we spread it and put this part actually against the outside of the foot. So watch. I'm going to flip it over so the strap goes over here. The handle goes on the inside. Cinch it up, and then let the rest of the webbing come across the foot. That is a pretty tight application of the force right there. It doesn't want to slip at all. If I keep my legs straight, it's a lot easier to just perform the subtalar motion. Again, this is not necessarily ankle motion. The ankle's a hinge, so we're getting more subtalar motion here. There's inversion. If I bend my knee towards 90, now I can perform internal tibial torsion, which a lot of people feel is really helpful. Now, this is going to involve some medial hamstring here a little bit. Not a bad little motion, but you can see the difference between just this stabilized ankle, or rather subtalar, this bent. Now I have freedom in this loose pack position at the knee to get some tibial torsion. Not for everybody, but in the rehab setting it might be useful. I could obviously do a similar setup. Strap, handle, let the webbing cross back over. And there is my external tibial torsion or my eversion. There you go. Now, you've seen seated calf machines before where the knee is bent about 90 degrees, and that puts the gastroc in a position of slack using active insufficiency so that the soleus is working primarily alone. Now, your soleus is working on every calf exercise of resisted plantar flexion, but here, like I said, working by itself, you'll notice I've got a small 2x4 type block against the legs here so it doesn't slide, and it allows me a little more range of motion. And with my knee bent actually more than 90 degrees, there's a good chance that this gastroc's going to have a lot of slack in it. You can see some tension in the soleus right there. Another nice option with the squat attachment.